Thank you, Professor Touhami. Thank you for this opportunity. Allow me to take this great opportunity to thank you personally, and to, if you can convey my personal warm greeting to His Excellency Abdulaziz Saud Albabtain. This is a timely initiative, and I'm humbled that the ICRC and myself are invited to give our perspective to this important topic of solidarity and in tackling this unprecedented pandemic. Thank you also to allow me to go back virtually to Kuwait, and I'm glad also to see some of my friends, and especially the Dr. Samir Saran, who is leading this Raisina Dialogue, one of the leading dialogue platform. You know, this issue, we are going truly through unprecedented times. This calls for unprecedented response. And there is no greater time to be unified in our shared humanity than this, what we are going through. As this crisis unfolds, we must support the response where we can and how we can, building on our long experiences in our respective sectors. For the ICRC, as part of the world's largest humanitarian network, this would be in emergencies and the humanitarian sector, keeping the people we serve at the very front and the very center of our response. Many of these people are living in some of the most precarious conditions where there's maybe overcrowding, little access to water and sanitation, and lack of health care services, and in under-resources context and setting. This is making even more fragile against the situation of violence and armed conflicts, and here the list is long in the Middle East and in Africa and elsewhere. Additionally, the humanitarian actors, including the ICRC, are facing huge new challenges to respond and to contribute to respond to this crisis. This is compounded by the travel ban restriction, complicating the travel and the rotation of staffs here and there. This is also complicated by the disruption in the supply chains, logistical chains, and the difficulties to have essential supplies now delivered in where people need it most. I think many of the distinguished speakers mentioned this virus knows no borders. Our collective reaction to this pandemic must also be managed without borders. We need to use our influence to promote actions of solidarity. We need to mobilize necessary resources, and we need to stick together and collaborate to do whatever it takes to protect people's lives and health and minimize that fallout of this COVID, especially those in already fragile situation. As the pandemic continues to spread and public health systems are challenged by intense pressure, it brings with the additional challenge the secondary unintended impact and consequences of this crisis. It's the humanitarian impact of the shutting down of the whole societies and whole economies, putting the already vulnerable groups in graver danger. The ICRC response will be tailored along the lines of our core principles, as always, of humanity and impartialities. We will continue to engage with national and local authorities to support their response and help provide essential services where needed. In India, for instance, my regional delegation in New Delhi is closely working with the Indian Red Cross societies and other national societies in Maldives, Nepal, and Bhutan to support the response to this COVID. In India, we have around 50,000 Red Cross volunteers, frontline workers, are nowadays present on the front lines of over 500 districts to support communities in these times of crisis. We have been also sharing best practices from other countries, from other contexts where we are operating, guidelines, and especially guidelines on the dignified management of the dead bodies, on the prison management and health issues in the prison with the respect of COVID. We have been sharing this with all our partners and stakeholders to support this response. Let me here share with you two major points. The first one, for the future, from now and for the future, we need to invest in the health facilities and health workers. We have really to praise the health workers